look and they say, you know what, companies are now filing electronic 10Ks. They are now making available, generally, information about their plans, their pipelines, their products, their research, and we can aggregate this, put an application on top, and make it available to just the average Joe investor. And so, in the space of about 5 years, it completely devastated the central brokerage paradigm, moved into an E-Trade, and now individuals who are concerned or interested in doing their own portfolio can invest in for $7. They can make an investment in any company they want and have as much information in many cases as a centralized broker. So that paradigm is an interesting one to apply toward health information. It is a fundamental principle that more information is known about your products outside the wall of your company than inside. If not, then you don't have a profit. Because the users of your products or services should be more numerous than your employees. And the way that they use those information, if you're General Motors and you're making cars, there are more people driving those cars and working your company. And so they know individually as much about that car after having driven it for 50,000 miles. The difference now, though, historically that information was disaggregated. I mean, it was in pockets, and occasionally you have a AAA motor club who will do a survey and provide stuff information. But now the difference is the aggregation. And that's true certainly in research, it's true in pharmaceuticals, it's also true in health information. So the modeling that we're starting to see is a model where you had traditional healthcare where the knowledge and the power of how to treat someone was contained within the traditional healthcare setting. The physician's office had more information about the individual because they aggregated that from all the sources. The individual was reliant on the physician to tell them what they need to know. The physician was the central broker. We're moving into an E-Trade paradigm, and we now have a personal health records, which I think we're going to hear much more about. We have information getting generated outside of the traditional healthcare setting at far greater volumes than inside the traditional healthcare setting. Most people start their health information, start generating health information about themselves the moment they have a symptom. They've always done that. You talk to your neighbor next door, hey, I've got this rash, it's a little bit uncomfortable. And the difference now, instead of going to the neighbor next door and talking about it, they go online, they do a Google search. What is a rash on my, we'll go with knee, because it's a little more acceptable, doing? And they'll get this huge, you'll get 1 million hits, right? And so they sift through. And so information is getting generated in enormous amounts outside of traditional healthcare. And now we have sites that are starting to aggregate this information. If you go to a site called Patients Like Me, it's a fascinating site. Jamie Haywood started the site when his brother died from ALS. His brother was suffering from ALS, and Jamie, an MIT grad, said, you know what, this current treatment model is just broken. This is absolutely not working. I can't find anything about ALS except if I talk to my doctor. The stuff I find, it's flat. They put information on there and said, here are the symptoms you will probably find, or here's the side effects of this medication. And he said, you know what, it doesn't work. I want to know what other people are experiencing. And so we started this site. And it is as a chief privacy officer, I look at this site and I was just aghast at the amount of information people would put up. Not only did they anonymize it, they would put their full face picture up along with pictures of their family and say, and I had this rash, right? And they would share with each other and they would say, here's the symptoms I'm suffering, and here's the medication I've tried, and here's the side effects, but look, it helped. And they track these data over 6 months. And there's not just one, there are tens of thousands of people on this site now sharing this information. The power that they are starting to realize with this data is amazing. They are potentially going to revolutionize some of the treatments. They are doing grassroots clinical research with products that have long been over the counter and thinking of ways to repurpose them for treatments. So we are moving to areas where we are disintermediating potentially physicians with the model and the paradigm that's happening. If you look at the DNA testing, Right above that, Brainstorm Research Foundation, Linda Avey started 23andMe with Ann Wojcicki. Ann Wojcicki is the wife of Sergey Brin, who started Google. And so they hit on the idea, let's go to 23andMe. You can take a cheek swab of your saliva, send it in an envelope, and we'll run a genome array on you and see, we'll pick 15 of the most common diseases and see whether or not you have a genetic predisposition to them, and we'll let you know. And oh, by the way, for an extra fee, we'll also tell you, what part of the world your ancestors are from. And so they started building this out. Linda Avey took some of that basic idea and has now started Brainstorm Research Foundation for Alzheimer's research. And so the amount of information she wants to get into familial histories. She wants to get into epidemiological data. She wants to get environmental. What are the social aspects? She wants to harness the concept of Facebook, where people tell all kinds of stuff about themselves. Harness that into a medical website where that information could be information potentially important to determine why someone has certain predispositions or why a genetic marker suddenly triggers. So the business model has changed. Where's the money? Is 23andMe really going to survive? Do you really have any money? They try to sell data from the site to generate income. They try and sell ad space. But where's the model? 20 billion, 26 billion, depends if you add in a lot of the incentives, will be spent on HIT. Almost all of that money is going to the traditional healthcare. It's all going to try and wire the records together. Privacy is getting very little spend. It has some. Very little is going outside of a covered entity setting under HIPAA. The goal clearly to have EHRs by 2014. You've got all kinds of criteria. I'm on the Indiana Health Informatics Technology company that is distributing Indiana's ARA funds. And you're looking across, we have 5 health information exchanges that are profitable in Indiana. It's the only state like it in the country, far and away ahead of other states in this area. And we're still trying to figure out where exactly we need to spend this money to have the biggest impact. You're going to see improved safety for treatment as the first target for personalized medicine, and that's already started. The bottom line as I kind of move through these things is that there's no doubt that more health data is going to be available than ever before about individuals. Mobile devices, your smartphones, they're already, the telecom providers now are meeting with attorneys and regulators trying to figure out whether or not their health apps are actually healthcare devices, because if they are, they have a whole new raft of regulations to comply with. And so you're getting mobile devices, all of your remote devices, your glucose meters, your cardiac, your pacemakers are all wirelessly connected and gathering data, CPAP machines. Right, so this data is being generated in tremendous quantities. Broadband will absolutely play a critical role in extending this health information generation and accumulation and utilization, especially as it extends into the home and to rural areas. All of this that really is, frankly, very inevitable. But there's a but. And the but is really privacy. It's one of, I don't want to say biggest buts. It is one of the biggest issues that we're facing, right? It is the social aspects of what we're trying to do, the ethical and legal and policy issues. Privacy, this map is showing red is a comprehensive data protection law exists in these countries. In blue is other laws. So while the United States shows we don't have a comprehensive privacy law, we have hundreds, if not thousands, of data protection laws in this country. And healthcare is one of the favorite targets. And you look at, so nearly every country, save some in Africa, have extensive privacy laws. As a multinational corporation, this map is a nightmare, right? Because none of them are consistent with the others. The bottom line in all of it is data anywhere is going to be considered personal information. So this is a slide that's meant to kind of be provocative a little bit. Single